husband and I really like to travel, and when we travel, we like to hike a lot. My knee was preventing me from being able to do that.
The first thing is to talk with them, find out what they perceive their problem to be, whether it's the hip, the knee, the back, how it all fits together. More importantly is how does it affect their quality of life.
What impressed me the most about Dr. Aiken is probably the fact that no matter how many questions I had, and I had a lot of them, he stood right there and answered my questions, took time, explained what I needed to know before going into the surgery.
The Rapid Recovery Program, which has just been started recently at the hospital, is really very exciting because patients are getting better in the short term. They still have pain and it's still an operation, but what's happening is they are coming in, I think, better trained, better aware of what to expect.
About 2 months after the surgery, I could really do about anything I wanted to. I'm 5 months out now. I can do anything I want to do. I'm getting ready to go on a 2-week camping trip with my grandkids. My husband and I have a trip planned to Wyoming in August, and I'm going with my grandkids in July to the beach. So I think we've come full circle.
You know that at 3 months, you will be a whole lot better. You'll be doing most things that you want to do, but you'll improve for a year. You're going to have the occasional bad day. You're going to have a little bit of noise in your knee. All of that's normal, but you're going to feel a whole lot better.
Having the knee surgery was the best thing that's happened to me. It's made me be able to do the things that I had planned on doing in retirement. Don't put off the surgery. Go ahead and have it so you can get on with your life and do the things that you want to do now.